Now they are visible?
Yes.
Make it full screen, sir.
Yeah, yeah. So, good afternoon, dear friends. I'm thankful to Dr. Kanungo for inviting me. Of course, I am missing the physical meeting here, but we'll be there in Bhubaneswar in short time from now in our Diabetes India meeting. So, dear friends, I will be talking about the modern sulphonylurea with combination of metformin and what we say is a green swan of oral anti-diabetic drugs. Dr. J.J. Mukherjee beautifully highlighted that it is an era of combination of drugs. And in his second last slide, he highlighted that most of our patients are on metformin or sulphonylurea. So we still have great faith in sulphonylurea. Of course, once we say sulphonylurea, it is modern sulphonylurea like glimepiride. So what is this green swan? So John Elkington introduced the term green swan in the book Green Swans, and the green swans are solutions that take us exponentially towards breakthrough or systemic solutions to global challenges. So modern sulphonylurea like glimepiride is emerging as a green swan of oral anti-diabetic drugs in the management of our type 2 diabetic patients. Why and how? So here you find that it is a guiding light because modern sulphonylurea uses continue to lead in India as well as globally across type 2 diabetic continuum. Incredible speed, early, great and durable glycemic control is achieved with sulphonylurea as compared to most of other oral anti-diabetic drugs. It is having beauty and grace across type 2 diabetic continuum. It is gracefully working in our diabetic patients. We have great trust. So we find that more than 1 lakh doctors from India are having trust on sulphonylurea like modern sulphonylurea glimepiride because of its safety, efficacy, affordability, and it is available and appropriate in its working. Flexibility is also very important because you can prescribe it along with most of other anti-diabetic drugs as well as with insulin. And elegance of its effect, robust experience and evidence with aging gracefully is there. So if you look into history of sulphonylurea, it was discovered by Lobetiers in 1942. Work started, or you can say launch was there in 1956. And then you find that only one problem was there in UGPD, where tolbutamide, which was the first generation sulphonylurea, was linked to increase in myocardial infarction rate. Otherwise, if you see throughout the you can say journey of this sulphonylurea, particularly modern sulphonylurea, you find that in advanced trial there was a cardiovascular safety with glycoside. European Society of Cardiology study and Carolina study particularly are highlighting that when you are comparing glimepiride to linagliptin, both are showing cardiovascular safe. So, and then recently we had GRADE study and JADE study, that is Joint Asian Diabetes Evidence Studies, which are again highlighting that in South Asia, large number of our patients are on sulphonylurea like glimepiride. So dear friends, era in glucose management is changing. We are evolving from earlier glucocentric approach to cardio-renal risk reduction. And a very important message why Dr. J.J. Mukherjee was that today is an era of combination of drug. So whenever we have a patient of, let's say, cardiovascular and renal complication, of course, we will prefer to use GLP-1 or SGLT2 inhibitor, but these patients do require additional anti-diabetic drugs like metformin and sulphonylurea, which is modern sulphonylurea. Nowadays, we are not using old, or you can say first generation or second generation sulphonylurea. We are using this third generation glimepiride more commonly. So there is a evolution of management. Earlier, we were targeting only the hyperglycemia, how to bring down HbA1c. And then the second era was that you look at not only HbA1c, but also cardiovascular risk factors, side effect profile of the drugs like hyperglycemia, hypoglycemia, and weight gain. And then third era was the organ protection, where we are looking at all these newer drugs. So modern sulphonylurea like glimepiride is having green evidences from India. It has got large number of publications in Indian studies, right from JAPI to Corias to, you will find that it was highlighted as a combination therapy with metformin in our young diabetic patients, elderly diabetic patients, and even fixed dose combination and low dose combination were also studied. So green evidence from India, again, you find that these journals like IJEM, Indian Journal of Endocrinology and Metabolism, and other journals are typically clinically telling us very specifically that these combinations of glimepiride and metformin are very, very useful in the management of our type 2 diabetic patient. There was a debate in IDF in Lisbon in 2022, and the new phase sulphonylurea in the era of new oral antidiabetic drug was the topic. And they usually highlighted that sulphonylurea may be becoming the ugly duckling of oral antidiabetic drugs. Is it justified to say that they are ugly duckling? And the results were that no, it was not, because sulphonylureas control glycemic level, reduce my macrovascular and microvascular complications. They are safe, they are highly accessible, affordable, and high patient acceptability. Sulphonylurea continue to be supported by robust long-term evidence. We are using it for the last 20 years or so. Sulphonylurea has important contributes and remain important oral antidiabetic drug, especially in the context of the global, you can say, resource there. In JADE study, again, if you see the modern sulphonylurea like glimepiride are popular oral antidiabetic class in South Asian countries. It is providing good glycemic control and safety profile associated with the use of sulphonylurea, support their position as a key treatment options in patients with type 2 diabetic. Here you find that safety of modern sulphonylurea. Earlier, there was some confusion that ischemic preconditioning may be deteriorated by sulphonylurea, but that was happening because of older generation sulphonylurea. Newer generation sulphonylurea like glimepiride will not have any receptor on the mitochondria of the cells, and they are cardiovascular safe, should no longer be a concern when choosing sulphonylurea, especially glimepiride, for our people with type 2 diabetic patients. And here you find that there are so much of evidences, right from ADA, European Journal of Preventive Cardiology, Carolina trial, as we discussed, is very, very important, telling us that it is as safe as linagliptin. Then there was a South Asian Federation of Endocrinology societies are again endorsing the modern sulphonylurea. Then you find that other studies like GRADE is also telling us that it is safe in our patients. The latest shade of green, that is cardiovascular safety, European Society of Cardiology highlighted that there is a significant lower all-cause mortality, cardiovascular mortality, and number of hospitalization and emergency visit of heart failure and hospitalization for acute myocardial infarction or stroke with glimepiride. Long-term continuation of glimepiride use was associated with better survival, fewer hospitalization, and you can say emergency visits to the heart failure. And high dose glimepiride like 2 to 4 milligram is associated with lower cardiovascular mortality. These evidences are coming from European Society of Cardiology. Again, you will find that there are studies which are clearly looking at the cardiovascular safety of sulphonylurea as a second line drug. And here in this study, the objective was to assess the real world cardiovascular safety of sulphonylurea as compared to DPP-4 inhibitors and thiazolidinedione. And the net results are that second line sulphonylurea for glucose lowering are unlikely to increase the cardiovascular risk or all-cause mortality. Sulphonylurea are cost-effective and have widespread use and should remain part of the global diabetes treatment portfolio. Here we find that pleiotropic benefits of sulphonylurea are also highlighted. They have well-established shades of green in the form of immunomodulatory, anti-inflammatory effect. So modern sulphonylurea like glimepiride exerts antioxidant, anti-inflammatory effect by decreasing high-sensitive CRP, interleukin-6, interleukin-34, and TNF-alpha level in our patients. Glimepiride improves the insulin sensitivity, increases glycogen synthesis, and inhibits gluconeogenesis. And on right side, you can see that there are emerging shades of green in the form of improving adiponectin level, which is a good hormone in our body, which counteracts metabolic syndrome, and it also improves the testosterone level, because we know that in long-term treatment with diabetes, you have testosterone levels which are reducing. It also reduces triglyceride, total cholesterol, and LDL, and it also reduces VEGF and improves anti-pro-BNP, indicating that there are some benefits rather than any concern. Here in this study, they looked at comparison of dapagliflozin with glimepiride, and they wanted to look at aminopeptidase and interleukin-34. And the conclusion of this study was that both glimepiride and dapagliflozin significantly improved glycemic control and insulin resistance, as indicated by HOMA-IR and anti-pro-BNP. And glimepiride has a significant effect on interleukin-34 and not in IRAP. So again, indicating the beneficial effect of glimepiride. So modern sulphonylurea, like glimepiride, is having flexible action. And here we find that use in comorbid conditions, modern sulphonylurea are preferred over conventional sulphonylurea in patients with diabetes and cardiovascular disease. They are having grade A and evidence of level 1. And then you, of course, you find that they are having newly diagnosed long-standing or in long-standing diabetes, you can use them. Use in special population, combination of this modern sulphonylurea can be seen in elderly patients. Sulphonylurea in combination with other drugs can be used in Ramadan with some modification of time and doses. And in overweight and obese patient, it is also useful in monogenic diabetes, those where we have MODI like MODI 1, MODI 4, MODI 3. These sulphonylureas are very effective. Many times we shift the patient from insulin to these sulphonylureas. And then, of course, type 2 diabetic patient, even when they are elderly, and if you are giving sulphonylurea in milder doses carefully, then they can be tolerated, even patients of 90 years of age. So another important point is that sulphonylureas, like glimepiride, can be used with most of other anti-diabetic drugs like pioglitazone, like alpha-glucosidase inhibitors, like SGLT2 inhibitor, like DAPA or empagliflozin, etc. And with DPP4 inhibitors also. And even people are using them with insulin therapy. Like most of the time when patients are on basal therapy, they are already on sulphonylurea metformin combination most of the time. And then, of course, when you shift the patient from basal to twice-a-day mixtures, even then many times people are continue to use sulphonylurea with metformin. So the efficacy-wise, if you see clinical evidence and practice-based guidelines of the utility of basal insulin combined oral therapy, that is combination of metformin and glimepiride, here again, they say there is a synergy of action of glimepiride and metformin combination with basal insulin. They reduces hypoglycemia, weight gain, and cardiovascular profile. So combining basal insulin to oral therapy like glimepiride plus metformin appear to be having a very effective, you can say, thing of lowering insulin doses, requiring frequent insulin, you can say insulin injections, and they are also not causing significant weight gain, and they do not cause hypoglycemia here. So emerging, again, green, you can say emerging green, you find that the prevalence of clinical features in MODI patients, as we discussed, that patients who are having monogenic diabetes, like having defects in HNF1 alpha, HNF4 alpha, and ABCC8, these are the monogenic diabetes where patients usually were put on insulin thinking that they are type 1 diabetic patients. But once we go for genetic testing and identify these defects, then we can shift them to sulphonylurea like glimepiride or glibenclamide. So here you find that there is a position of sulphonylurea in current era. This is a review of national and international guidelines, and they say that sulphonylurea continue to play a vital role in the management of our type 2 diabetic patients. Majority of the international and national guidelines reviewed suggest newer sulphonylurea like glimepiride as a second-line drug. And if the patient is not tolerating metformin, sometimes we even give it as a first-line drug. And glimepiride are having efficacious, comparatively less expensive, associated low risk of hypoglycemia, and hence, despite the continued advent of newer glucose-lowering therapy, sulphonylurea may still be the ideal pharmacological treatment choice in our developing countries. And as we discussed earlier also, that today is the era of combination drug. Most of our patients, because of progressive nature of diabetes, require combinations. So patient may be on SGLT2 or DPP4 inhibitor, but adding sulphonylurea with metformin is a very good options there. So here you find the international guidelines like ADA, IDF, SPED, again highlighting nice guideline. WHO, ESD, and ACE guidelines are again telling us that sulphonylurea are useful drug. You may be using them as a second line or third line agent. Sometimes these patients are not tolerating metformin, so there you can use it as first line drug also, and they can be combined with most of the other anti-diabetic drugs. If you go for another large number of these country-wise guidelines like Canada, Colombia, Australia, etc., Korea, China, and of course in India, RSSDI guidelines, again, all these guidelines are telling us that sulphonylureas are still very important armamentarium in the management of our diabetic patients as a second line agent, as a third line agent. And if the patients are not tolerating metformin, sometimes we use it as a first line agent also. So in this great randomized clinical trial where the aim was to evaluate kidney outcome in the glycemic reduction approaches, and they looked into what is the effect of glimepiride here. So there was no significant difference in kidney outcome, which was observed during the 5 year of follow-up of these patients who are on either DPP4 inhibitors or sulphonylurea or GLP-1 or SGLT2 inhibitor, indicating that all these drugs are very good drugs in this type of patients. Dear friends, there is a concept of maladaptive anabolism and predominant catabolism. So we categorize our patients of diabetes according to whether they are gaining weight, developing obesity, where high insulin resistance is there, or they are losing weight, they are thin, cachectic, and there the main problem is significant insulin deficiency. So here you find that sulphonylurea is acting as a fulcrum. It can be used in other therapies which are anabolism, and those who are catabolic in nature, you can combine sulphonylurea in them and you can get very good results. So it is in the center of the fulcrum. I think this slide was greatly highlighted by Dr. J.J. Mukherjee, but here I want to highlight one thing, that in addition to newer drugs like SGLT2 and GLP-1 receptor agonists, we have to sometimes look at what is the control of our diabetic patients. And in that, if you look at high potency, you find sulphonylurea is mentioned here. Again, in ACE guidelines, you find that these are the patients who are not able to afford costly anti-diabetic drugs, and access to these drugs like pioglitazone and sulphonylurea are considered to be good because they are economical. So the 7 shades of modern sulphonylureas like glimepiride is that they are having sweeping experiences, sufficiently available, subliminally affordable, superiorly effective, safety is there. They are also cardiovascular safe, splendidly acceptable, and surprisingly researched. So long duration of experience is there. So we must never forget that 80% of people in diabetes are living in lower or middle income countries. We need a medication that are effective, affordable, available, acceptable, and having minimal adverse side effects. And in that scenario, modern sulphonylureas like glimepiride comes in our mind. And important thing is that we have to be using these drugs, starting with a lower dose, gradually increasing, advising the patient dietary modification, and telling him or her that what are the signs and symptoms of hypoglycemia and how to avoid them. So in the end, again, I will repeat the same thing, that the modern sulphonylurea like glimepiride is a green swan of oral anti-diabetic drugs with guiding light, incredible speed, with grace, with great trust, flexibility, and elegance. We can use sulphonylurea like glimepiride in large number of our patients. So let's take a small step towards making the change. Go green planet. And here we have a green drug in the form of modern sulphonylurea. I think I should stop here. Thank you very much. If any questions, I will be happy to answer. Thank you, sir.
Kindly wait for some time. Lot of questions will come
Okay.
because